I'm going to ask Dee Mayhew. Are you a member of the team or are you with the press? If you wouldn't mind identifying yourself, that would be lovely. Hello, Dee.
So that I don't know quite what's happening with the IT there, but Dee Mayhew is one of our system companies.
Oh, okay. All right. Perfect.
LRF comms group.
Apologies, I didn't know that name off the top of my head. So we'll start with Kevin Nichols, please. Kevin, are you there? If you just
yeah, hi. Can you hear me?
Yes, there's a bit of reverberation on there.
Yeah, sorry about that. I'm trying to record you on one machine and not on the other. 1 second. Sorry, is that better?
Thank you, Kevin. If you would introduce yourself, and then we'll come back to questions if that's okay. Kevin, we've lost you again.
No, sorry, I'm here. Can you hear me now?
Yep, thank you.
Sorry, I missed what you said, Ian.
Could you just introduce yourself? And
sorry, I'm Kevin Nichols. I'm a reporter from the Chronicle and Echo newspaper.
Thank you very much. Laura, are you there? Laura Coffey, I know you're from BBC, but if you wouldn't mind introducing yourself, that would be great.
Yeah, so Laura Coffey, political reporter at BBC Radio Northampton.
Thank you very much. Nadia, are you there?
Hello, sorry, yes, I am from BBC Cambridge.
Thank you very much. Is Hannah there? Is Hannah part of our team or is that Hannah from the press? Hello, Hannah.
I am just part of the team.
Thank you, though. Thank you. We've got someone under here, Tanya Mayer. Tanya Mayer. Sorry, I don't know if that's not.
Oh, yes, Tanya Mayer from ITV Anglia.
Thank you very much. And we've got one here as news. Okay, obviously there's a connection problem there. If we could now proceed to questions, that would be great. So if you wouldn't mind using the raised hand.
Sorry, there's also a gentleman, Martin Heath, online, I think.
Ah, yes, Martin.
Yeah, Martin Heath, newsreader and reporter at BBC Radio Northampton.
Oh, I do apologise. Sorry, sir. Thank you. So if we could then proceed to questions, and if you wouldn't mind using the raise hand facility, and we'll bring you in as and when. So who would like to start? I'm not seeing any questions. Laura Coffey. Hello, Laura. Feel free to ask your questions.
Hi. So firstly, how long will this guidance be in place?
I will pass you to. Did you have a subsequent question, or is that?
Yeah, I have quite a few questions.
Okay. Do you want to list them all, and we'll go through them with the party? Thank you, Laura.
Yeah. So, how long will this guidance be in place? What's the reason for the spike in Northampton? What do you think that reason is? I know it's been mentioned in the press release you sent out on Wednesday evening that the population density and the high proportion of people with underlying health conditions, but surely there are other places in the county that have a similar issues with underlying health conditions, and why aren't they seeing spikes? You say you're speaking to the community leaders. Are you also speaking to employers? I know that, Jonathan, you touched on that a bit there earlier, but I know yesterday during the overview and engagement board meeting, it was mentioned that there have been outbreaks in food production companies and in distribution warehouses. Where are these? Also, it was mentioned in that meeting that employees are meeting socially, and there is concern about this. So what's being done to try and encourage, I know obviously there's this guidance, but specifically what's being done to try and encourage employees who are meeting socially to not do that and to decrease the spread. Listeners have also been contacting us to say, why is there not a clear mention of these additional guidelines on the social media of the councils, and also on the website. I know on Northampton Borough Council, it is on your website. You have to scroll down to the bottom of the page to find the guidelines there. Northamptonshire County Council, again, I know it's on your COVID-19 coronavirus update page. It actually says Northamptonshire, residents in Northamptonshire need to be concerned, and then you click on the link there. So, I mean, it should say Northampton, but listeners have been saying that they don't feel that that guidance is very visible to them. So that's just a few questions.
Thank you, Laura. I may split that up if that's okay with you. Lucy, can I bring you in to answer some of those questions? And then I think in terms of the local engagement, if Jonathan wouldn't mind coming in on that a little bit, that would be great. He did allude to that anyway, but Lucy, over to you.
Thanks, Councillor Morris. So the length of time that the guidance will be in place will be for as long as it's required until we get the results that we need. You know, we obviously need to see a complete buck in the trends of, we need testing to be increasing. We obviously will then see quite naturally our cases go up initially because we're technically just going to be case finding. So once we are confident that although we've got new cases, that the overall case positivity is going down, it means that the circulating viral load is going down. So we expect, because we're driving testing through, to see an increase in cases, but it's the interventions to make sure that that then doesn't continue to spread. When we can see a significant and sustained downward trend in the incidence of the cases and the positivity of the cases, we will then be able to consider, with guidance from Public Health England, Department for Health and Social Care, as to whether we can start to step some of those measures down. But you can see in other areas, this is not a quick battle. And, you know, we do know that there's an incubation period on average, so it can be longer than 14 days. So, you know, we would be looking to maintain what we're doing at the moment for 14 days to make sure that we can then see how that effect is moving through the data. And of course, there are always still delays in that data being reported. So, you know, we won't see the result of our efforts for, you know, the last 24, 48 hours for at least a few days as well. So we have to consider how that data lag will also impact on our interpretation of the situation. But we continue to obviously look to our regional convener and Department of Health and Social Care, Secretary of State, to get a view on what level of intervention they feel that we need to take next. From a point of view of the reasons for the spike, you know, we're doing a lot of work with what's called a group of field epidemiologists in Public Health England. They still have, you know, much greater access to granular data than we do. And they're helping us look at the case makeup. One of the things that we're doing with the last 50 cases that have been identified as positive is, as of today, going through quite an in-depth interview with them to find out what they've been doing socially, where they work, how they live. You know, do they live in houses of multiple occupation? You know, when we know there's quite a high rate, a number of those in our town centre particularly, where do they work? All of those kinds of things, so that we can understand, because this is quite a spattering of cases, as I've said, across the borough, you know, where they're likely to have contracted the virus in the first place. That will help us obviously gain some insight as to what the cause of this spike is, and also to make sure that we're testing the interventions we've proposed are going to be effective. I'll quickly cover before I hand over to Councillor Nunn around the engagement elements. Like you say, that the Oversight and Engagement Board, we talked about outbreaks. So we've got outbreaks that continue to happen both in care settings and employment settings. And there are 8 at the moment that are larger numbers, or that are, you know, sustained, where we've got continued communication of the virus within that setting that we are actively managing. Public Health England obviously support us to do that, as do a dedicated community-based infection prevention and control team. We also work with our environmental health officers and the health and safety executive to make sure that those areas end up being, you know, if they're not already COVID secure. We have found a hugely high level of compliance. And that's, funnily enough, it's one of the things that you picked up on is, you know, some of the ongoing outbreaks where we'd done 3 site visits, you know, had outbreak control meetings, interviewed employers. We still couldn't understand why that continued transmission was happening. And it was only on interview with the employees themselves that were testing positive that we were able to understand that, for example, although their compliance in the workplace was extraordinarily high, they would then car share on the way home. Or they would, because people obviously are coming out of lockdown, that they would have social gatherings because obviously they hadn't seen each other outside of the workplace for some time. And it's interesting, and it's one of the messages that we do need to make sure that people understand. The guidance to make places COVID secure that we're exercising in our workplaces, you know, we need to remember those guidelines now as we go back into our social spaces as well. And it's one of the reasons that we've kept our messaging, you know, really quite aligned with that original guidance around 2 meters is the best social distance when we consider the transmission mode of the virus. You know, regular hand washing is still the best way to fight any virus. You know, we need to make sure again that people aren't socially mixing with a large number of people, because it makes that onward transmission so much easier. So how we're regulating our practice in our workplaces for those that work, it's those guidelines that we want to make sure that socially we're also now following. So you can see that we've done a huge amount of work with those specific employees in those particular employment settings to make sure that those messages get taken out into the outside of work environment, so employees continue to remain safe even when they're not working. So if I hand over to Councillor Nunn to pick up on some of the engagement and communication elements.
Lovely, thank you, Lucy. Yes, happy to. Some excellent questions, Laura. I think that the bit is about expanding a bit more on the engagement. The leaflets we mainly talked about initially targeted the 2 wards, 11,500 properties, then with further translated versions, and through the many groups that we have some contact with, and we have an excellent database on groups of all types. Interesting point in the website. We've thrown together what we needed to do quite quickly. We'll have a look and consider maybe whether that needs more prominence. Alongside that, we're doing a lot of social media promotion, and actually unusual for us, we're actually exploring the paid for social to try and target postcode media, paid for social media to target the postcode areas, particularly within those wards, although again this is a town-wide problem. I mentioned the bid and the fact that their staff are kindly putting leaflets out to businesses. Of course, we've been working for some time with the bid particularly, and the county council and others, but particularly focused on the opening up again of the town centre with the business improvement district, and that's include all the safety measures that you've already seen. But I think it's today that the posters have all gone up in shop windows, hopefully insisting that people should wear a mask, for example, when they go in there and so on. Hand sanitizers, which the bid did a bulk purchase of for all town centre businesses. If you're in the town centre, you're automatically a bid member, and they did a bulk purchase so that all businesses would have sanitizers, but they have also now backed that up with masks, so that as people go into the shop, if they haven't got a mask, they can be given a mask, and certainly so that all staff will have them. So there's a little bit more going on there. I mentioned environmental health, and the key people that they're engaging with is those businesses that are, if you like, licensed or regulated. So licensed perhaps means alcohol, or regulated food standards and that kind of thing. So they will be actively out there engaging with those. We do have a video. I think it's a local GP. I think we've got this confirmed now. Is creating a video to put from a strong sort of GP medical position what the issues are and the importance of the precautions, which actually will also be translated as well. I think a big part of this engagement, though, is perhaps, if I may say so, this event. And speaking to you particularly, Laura, and BBC colleagues, we're extremely grateful for the prominence that you gave the whole issue this morning. It really was important, and we were grateful for that, how well it was done. And I suppose we would say, you know, more please. And although this is a single event, we want to keep the dialogue open for anything you need to do, and have an honest exchange of what your listeners or readers' concerns are, and what the latest news is for us. But I hope that gives a little bit more depth over what I said before about the engagement. But again, we're open to ideas, of course.
Thank you, Jonathan. I mean, of course, we're also learning lessons, aren't we, all the time from Public Health England and other areas that have had a similar issue. We're sharing data and information with them as well, so that we can learn from situations as in Leicester and Blackburn and various other places. So it's an ongoing learning curve for everybody. But I do think it's I think we're ahead of the curve, if you see what I mean, in the strictest sense of the word. Laura, are you content with those answers? Would you like to follow up with any subsequent questions, or can I move on?
I'll let someone else, but I may like to come back later if that's possible, but I think otherwise I'll take up all the time.
No, fair enough. Okay, now I'm going to ask Martin if he wants to come in now. Martin, did you have any questions? Oh, you're still muted, Martin.
Oh, yeah, we are. How's that?
Yes,
You got me now.
Your hand up, but since I can see you, I thought I'd ask you if you had any questions.
No, nothing further to add to what Laura's asked. I think she's asked the things that we were wanting answers to. So I'll go with that.
Thank you, Martin. I've got Anna Lewis here now with her hand up. Thank you, Anna, if you're there.
Hello, sorry I didn't get introduced myself earlier. I'm a journalist from Northampton Live. I just had a question for Ms. Whiteman, if I could, if possible. I was just wanted to ask that. I know on July 2nd, I think you told residents sort of not to panic when new data was released showing there'd been an increase in coronavirus cases in Northamptonshire. We just wanted to ask whether in hindsight you believe that was the right advice to give at the time?
Yeah, absolutely. So the change, if you remember, on the 2nd of July was about the fact that there was Pillar 2 data that was released to be added to Pillar 1. So there was a national sort of artificial increase in the number of cases because we'd only had, and the government had only been reporting a certain stream of case reporting or testing until that point. So what we wanted to make sure was that people understood that the circulating prevalence of the disease hadn't changed, but what this was doing was bringing together two different data sets, some of which we hadn't even had access to locally, so that we could understand actually what the full picture was. But as you will have seen, you know, that was the same everywhere. Nearly everywhere saw a doubling in the reported number of cases. What we didn't want the population to do is think that that was a particular issue to Northampton and therefore, or Northamptonshire, because it was reported at that level, and therefore consider that there was a Northamptonshire issue. As I said, it was about a government decision to bring two pillars of reporting together so that we had a much clearer collective access to the data, and it was explaining why that change was happening and what that would do to the case numbers.
Thank you very much. That's helpful.
Anna, are you happy with that?
Yes, yes, that's great. Thank you very much. Cheers.
Thank you. I can't see any other hands up unless I'm missing something. If everyone can indicate if they're, in which case we can come back to Laura, as no one else seems to have their hands up at the moment. Unless they're...
Can I ask then, are you confident that people will follow this guidance? I mean, just looking in Abingdon Park, people are already in quite close groups, kind of the social distancing, everyone seems to have relaxed a lot now because there has been an easing nationally. Do you think people here in Northampton will now follow this guidance that you're introducing again? That lot, because although we're not having a local lockdown at the moment, this is to try and prevent it, it does feel like those measures are back to where we were in March, which will be difficult, I imagine, for people to take that step back.
I'll bring Jonathan in on that, but I have to say that's one of the reasons for bringing out these measures is that the seriousness of the situation we're in, and doing things like this is to emphasise that we want the people of Northamptonshire to come to help us with this situation. We need to bring everyone along on the journey, as it were, so that we can bring these numbers down. Jonathan.
Yeah, thank you, Ian. And great question. No one has more faith in the wonderful people of Northampton, but we're stood at a fork, and I think it's all within our own hands, really. I'm extremely hopeful that they'll follow these, and I'm extremely hopeful that we'll therefore see these rates decline, more tests come in, and fewer positive cases. I'm therefore hopeful that we won't see Northampton locked down. From where we are now, there is a possibility of going towards Leicester and finding that non-essential businesses and pubs and things are closed. Our gyms don't open on Saturday, or they open on Saturday and they don't stay open for long or whatever. It's all down to us, and I mean every one of us individually. Because I also feel strongly that from this point, the other fork in that road is that we do continue, that people follow the advice, the numbers improve, and that we're able to continue, if you like, get back to the sort of easing of lockdown that's generally happening nationally. So strongest possible hope, but absolutely it's within everybody's hands. And I think that's the message, really. We've never needed such a collective effort on behalf of each other as we do at the moment with this in Northampton.
True, and it's it's been very, very lovely to see everybody working together in such close quarters as well, and in such an emergency. But hopefully going forward, this is the sort of start of something that will carry on. Anna Lewis, did you want to come back in?
Could I come back in if Anna doesn't?
I'm fine, thank you very much.
Anna's, you don't want to come back in?
No, I'm good, thank you.
Oh, right, thank you. Sorry, I'll take your hand.
Oh, sorry, yes, I didn't realise. Ignore me.
Don't worry. Laura, I'll come back to you then.
Thank you. So there's, as we know, there's been a rise in cases in Northampton. In that meeting that I mentioned that you were all in yesterday, Lucy Whiteman, you also raised the issue of that you're aware of a concerning trend in Kettering and potentially in Corby. How far are those two towns away from a similar situation like what we have in Northampton?
Lucy.
So it's a very difficult thing to be able to definitively measure, because obviously the case rates and the case numbers and the positivity rates get reported on a day-to-day basis. And although obviously we are consulted, the decision about whether an intervention happens very much still happens, sits with the Secretary of State. And they do take into consideration things like, how close you are in proximity to other areas of concern. So you are more likely to see the Secretary of State take action with Kettering and Corby, because we've already got one area of interest within our county. So the thresholds do tend to be a little bit of a movable feast. And obviously, as I said, it's about the context and about the assurance that we're able to provide locally about the actions that we're taking. And again, it's one of the things that we alluded to earlier. Although there are some specific wards that seem to be hotspots, the cases are dispersed across the whole of the borough. And as we've talked about now for a number of weeks, our overall county rate has not decreased at the same pace as everywhere else. So, we do watch that on a day-to-day basis. At the moment, we're seeing that we've got similar trends where tests are going down. Obviously, that's something we can take immediate action around. We can't influence right now whether those are positive or negative test results. But as you know, what we've decided to do is therefore make sure that we're stepping up access to testing in those key areas. And obviously, for the reasons that we've published that leaflet, which of course reminds people of how they can access a test through the national programme. They can still obviously attend regional testing centres if they've got the ability to travel. And of course, if they can't do any of those things, then they can still have a home test. So it's making sure that people remain aware and that we start to move some of those trends. And the first one, as I said, that we can all affect, as Jonathan has said, and we're hopeful that the community will engage in this, is making sure that they do access testing as soon as possible if they've got any concerns.
Thank you, Lucy. Can I bring in Anna Earnshaw? Hello, Anna.
Hi, good afternoon, everybody. I just wanted to say, in terms of Corby and Kettering, I mean, what we're all very keen on, obviously, is we don't wait for something to happen. And as you say, we've had some concerns about those areas too. We're very much actively already behind the scenes involved with the chief execs there and the leaders there. And it's very important we start with the same kind of messaging, just generally to the communities there. None of us want to see any kind of lockdown in any of our areas when we're on the start of this recovery. So that's going on now. And if we need to, we'll do exactly the same thing and then start to raise sort of more targeted campaigns. But we're already in active conversations with them, and we're already doing the same kind of things with businesses there, with local environmental health officers and kind of general awareness campaigns. So it's not a question of us reacting as each one happens. We're trying to make sure we're doing this across the piece, as Lucy says.
Thank you, Anna. Hello, Laura. Did you want to come back in?
I was just going to say, I understand that some of the measures that were in place when lockdown started had been stopped. For example, some of the regular meetings that with kind of community leaders that were being held, some of the community wardens that were out and about. was that a mistake to stop those when they were, I don't know when they were stopped, but I understand that they didn't carry on, I guess, when lockdown began to ease, but they are going to start up again now in Northampton. Was that a mistake to stop them when they did?
I think, Lucy, did you want to answer that one? Although, of course, hindsight is a wonderful thing, Laura, I would say, but I'll come to Lucy on that question. Thank you, Lucy.
So no, I don't think it was a mistake. I mean, as Ian says, that there's always hindsight is 2020. But at that point, we were confident, and we took a collective system decision with, you know, all of our chief execs, you know, all of our system leaders, PHE, NHS England, and improvement around the table to say, actually, you know, the trend is in the right way. We are declining. Yes, not at the pace, which is why we've continued with that messaging around we're not out of the woods yet. But it was the right time to start to step down some of those meetings, because also we've got to remember that lockdown and, you know, the measures that were implemented in March also have had some detrimental effects to the wider population, both, you know, from a healthcare perspective, where a lot of the services like testing, etc., you know, had to be shut down to make sure that we could provide adequate hospital facilities for those that did need high-level intervention for active COVID infection. And also economically, it's had a significant impact. We know that it's affected employment. We know that it's affected, obviously, the local economic prosperity. So at that point in time, no, it seemed like the right steps to be taking, but it's why we've continued to very actively monitor the situation, and why we are able to take at this point still what are considered, as I said, the proactive steps that we're taking to stop us finding ourselves back in that position that we were in at the beginning of March, or in a position that Leicester City or you know, Blackburn and Darwin have found themselves in. As I said, we're in a space where we've still got the ability to turn this round, but if we can't engage the community to help us with this, then we may find that we have to take much more severe steps, and that's obviously what we want to try and avoid.
Thank you, Lucy. And yes, it goes without saying that view is endorsed by everyone that's here. We're asking the people of Northamptonshire to help us out here, and specifically the people of Northampton, but it's very evident that this hasn't gone away as a public health issue, and that's part of our messaging, I believe, around this as well, is that this is a signal that the crisis is not over by a long shot, as has been pointed out. Lucy, yes, feel free to come back in.
Can I just add to that? Because I think one of the things that people do need to understand, and actually, you know, Laura, I do understand why you're asking the question about how likely people are to comply, and it's heartening that Councillor Nunn feels they will, but we've got to recognise that the peak at the moment is affecting a different age group to the previous pandemic peak. That very much saw our elderly population, people with significant underlying health conditions ending up being hospitalised, and as you know, unfortunately, a number of them dying. At the moment, the age ranges that are being affected, for women, there's two age groups, the over 80s, and that is likely to be associated with care home setting outbreaks. But we have got a group of 20 to 30-year-old females that are testing positive. So you can understand, you know, we do need to be making sure that the wider population, and those people who probably didn't feel they were impacted directly, do take these measures. And for males, it's the 30-year age group. So you're right to ask around the socialisation, etc. And that's why we're making sure that we've got people on the streets who are visible and who are actively engaging with those populations to remind them of the risk. And although people may perceive that risk to be low to them personally, because we do know that it tends to be milder symptoms if you're younger, we need to remind people that we need them to help us protect our most vulnerable, as we also see older and people who are more vulnerable with underlying health conditions coming back out of lockdown as well. If we see a middle age or younger age circulating viral issue, then we are putting the wider community at risk again, and we could easily find ourselves, as I said, escalating from a point of view of that spreading across our age groups and affecting those who genuinely cannot protect themselves. So it really is a call to action, because it's a very different message, because it's a very different group of people that are being affected.
Thank you, Lucy. Laura, did you want to come back in again? I don't have any other hands up for further questions. So
no, that's okay. Thank you very much.
Thank you. Kevin Nichols. Yes, hello, sir. Come in. feel free to ask your questions. You are still muted, I think.
There you go. Is that better?
Kevin.
Yeah. Sorry, can I just clarify something on the statistics? Because the press releases in the last couple of days have quoted a number of 533. But the people that read our paper aren't necessarily sure exactly what that means. When Leicester was put into lockdown, there was a number quoted, which was about 140, which I believe related to the per thousand of the population, I think in a week. The 533 number, where does that come from?
Lucy, can I ask you to answer that? Thank you.
So I think, I mean, I've got slightly different numbers, and this is always part of the challenge, and you know, a challenge that we continue to work with between Public Health England, Joint Biosecurity Centre and the local public health team, is making sure that we're all using the same data sets, because as I said, the data is being literally released on an hour-to-hour basis, on a day-to-day basis. But I think you're probably referring to the case rate per 100,000 population, which is available on the national government website. And it's available both for the countries, the regions, the counties, and the lower tier authority levels. So at the moment, as of 4 p.m. yesterday, the case rate for Northampton is 457.2 cases per 100,000 population. For the East Midlands, it's 475 cases per 100,000 population, but you can understand that Leicester City has considerably increased what the regional average case rate is. The England, which is probably a better comparison, is 456.9, but again, that's increased quite considerably in the last 2 weeks because of places like Leicester and Blackburn and Darwin, Luton, Peterborough, etc. So we're trying to benchmark ourselves constantly, and it kind of relates back to the question we were asked earlier about, well, what's the threshold for Corby and Kettering, and you know, much stronger activity and intervention there. And because this is such a movable feast, those thresholds are quite challenging to nail down. So that's why we look to our regional and national colleagues to help us make that judgment. But I'm assuming they're the case rates that you're looking for. Do also remember the point I made earlier, though, about the fact that Leicester City lockdown decision was made, I think, prior to that Pillar 2 data being released. And as I said, that gave an artificial hike in everybody's case rates. So it's a very difficult position to compare prior data sets that weren't inclusive to the decision thresholds now that we've got a different set of data being used as a benchmark.
Thank you, Lucy. Kevin, did you have a subsequent question?
Yeah, if I could just come back on that, because obviously the what's published by the government each day is the actual number of cases. And certainly in the last couple of days, they've been very low. I think 3 on 4 successive days for Northampton. Are you saying basically the problem isn't necessarily the number of positive tests, but it's the number of positive tests per test, if you see what I mean? Yes, it's the number of tests. You want more tests rather than more. There is a situation where there's lots of positive tests.
Yes. So
cool. Thank you.
At the beginning, it was those 3 variables. Do you remember that the reducing number of tests that were taken, the high positivity rate, and then the cumulative 7-day incidence? But just to put it in context, 3 does sound like a really small number, but for the whole of the East Midlands, there were only 5. So when you start to put that in context, you can see that there is still a significant challenge locally.
Thank you.
Thank you, Lucy. Kevin, are you happy with that?
I'm very happy with that, Ian. Thank you very much. Could I just have one more, though, if you wouldn't mind?
Yes, sure. Why not?
You mentioned, I think somebody, Laura, asked how long this might go on for. The government guidance changes next weekend, particularly with stuff like returning to workplaces, public transport, etc. Are we going to get into a situation next weekend where Northampton's going to be different from the rest of the country on that?
Lucy, did you want to answer that one as well? I'm sorry to bombard you with questions, but that's why we're here. Carry on, Lucy.
Exactly, that's what I'm here for. I really can't answer that question, and I think it would be misleading if I did. As I said, the situation changes on a day-to-day basis, and you know, it very much depends, as I said, how assured the Secretary of State is and the leaders in Health and Social Care, Department of Health and Social Care and Public Health England, as the robustness of our plan, but also the response of the public. So we need to make sure that obviously we continue to engage, and it will only by monitoring that level of engagement that we'll be able to provide them with the assurance that we can continue as we are. If they don't feel assured, and or if we feel that there is a continued risk to the wider population, then we will need to start to consider, with their support, other steps. But I can't tell you either way how this is going to play out. All I can say is that, you know, we are in this together, and we're very much reliant on the public joining us in this endeavour to start to make sure that we get a grip of the current situation.
Thank you.
You're on mute there, Ian.
Sorry, I'm just looking around the room to see if there's any other hands up for questions. I'm not seeing any. So I think if everyone's happy that we will, Jonathan, did you want to come in?
Actually, I will then, if there's no other questions. I'll just add to Lucy's comments there. Clearly, I come from a different direction as without the medical professional background and so on. My reading of that, though, is actually we might be different in a week or so. And I think that's the challenge we've got. It's up to us what we do over the next week or so. And there might be a tendency to shy away from a question like that, Kevin, and I'd face up to it. And I'd say, we might be talking in a week about different arrangements for Northampton to the rest of the country. That's down to what we, as a population of Northampton, do in the next week or so. And just finally, in case we ring off without doing it, it's a quick reminder of the information on the testing, which is absolutely vital, which is either a choice of phoning 111 or going to nhs.uk/coronavirus. Very simple. I've had a look at it. It's a very simple way to quickly book in a test. Sorry, Ian, thank you.
Thank you. Lucy.
Yeah, just to reiterate as well, obviously under the circumstances, we are happy for people, although we'd encourage them to make a booking to have the test. We do know that people don't typically get turned away should they obviously happen across a testing centre. And as I said, we're trying to make sure that we can even engage much more actively in that opportunistic test approach, and so we'll be able to inform you of those centres as and when we get support to do that with our regional colleagues. So hoping to give you some more positive news about different options again next week.
Thank you, Lucy, and thank you, Jonathan. I think if everyone is content, that we will draw the meeting to a close, if that's okay with everybody. Thank you very much, everyone that's attended, particularly from members of the press, and thank you very much for your questions. It's clear that there's some work to be done, but we are very capable and able of doing that work. And with the people of Northamptonshire, I'm sure that this situation will resolve itself relatively quickly. Thank you very much. Thank you, everyone.
Thank you.
Thank you.
Thanks, everyone. Thank you very much indeed. Thanks, Ian.
Thank you very much.
Thank you.
Thanks. Bye-bye.
Should we stay on for a bit?
I think I've removed everybody that's not NBC, NCC or NHFT. Looks like everybody else has dipped out anyway.
They've all run away.
Understandably.
Well, thank you for organising that, Craig. I think it was all right. Sorry, it was a bit of a blip at the start because I couldn't really work out who was press and who wasn't.
It wasn't just you, Ian. No, it's not easy when a lot of them don't actually have their names on screen.
Yeah.
I completely understand that. It's my pleasure to organise. I mean, obviously technical issues.
Well, you're bound to have those, aren't you? And I don't think I made too awful a job of it, so we got it done. That's the main thing.
No, it was great. I think actually it went very well. I think fair enough, some challenging questions, but I think all of the answers were perfectly reasonable as well. I think
it was good.
There were good answers to everything.
Yeah, it was good to have Lucy answering a lot of questions, I think, because there has been that criticism that she hasn't been seen enough, which is not, I don't think, fair, but I think she was in a very good place to answer all those. And I think Jonathan also got to put forward all the political stuff. So I think it went well.
Yeah, I think that was key. I think, like you say, it is hard because there's only one of her and she's got all the knowledge, but she's needed in 100 places. But having that, she presents very well, and I think that her message coupled with that kind of, you know, pushing it back on the public was good and strong.
Yeah, good. Okay, thank you very much. And it's difficult to chair and answer questions is one thing I realised. So if we do it again, I'll just chair it.
Don't blame me.
All right, thank you.
Thank you very much for doing it.
Thank you. Thanks, Craig. Thanks, Ian.
Great. Bye.
Bye.
Bye.